Well, good afternoon, MRHA listeners. This is not a podcast episode, but this is a webinar where we're going to record it for our rural hospitals and all the stakeholders of our organization that would like to listen in. But I have the great pleasure of having the founder and CEO of Sensato, John Gomez, on with us this afternoon. John has a strong background in NIST, critical infrastructure, and has been involved in cybersecurity and high technology for more than 3 decades. John is going to give us a very robust presentation today about what hospitals and rural settings need to know about ransomware and how to respond. So thank you, John, for giving us this presentation. We look forward to what you have to say.
You're most welcome. Thank you. So just want to take a moment to thank everybody for the time you're taking to listen to this presentation, and hopefully you find it to be a valuable source of information as you put together your cybersecurity strategy and think about how you want to evolve your own cybersecurity objectives. Just to give you a little bit of background in terms of Sensato and just, what we bring to the table from a knowledge perspective, I'm just going to touch on a few little things. We have been around since 2013. We were the first healthcare specific cybersecurity firm. And since then, we've obviously evolved quite a bit. To this day, primarily we work with hospitals throughout the United States. Variety of services that we provide, everything from maturity modeling and tabletop simulations and pen testing and HIPAA assessments, to incident response training and so much more. We also have our own cybersecurity platform, which is specifically designed for critical access in rural hospitals. Years ago, we decided to focus primarily in that space, and we've continued to evolve that. One of the things we have is a full end-to-end security program that involves software, 24/7 monitoring, templates, and a variety of other things to help organizations really focus on how to evolve security without breaking the bank, I guess is the best way to put it. There's a bunch of other things I can talk to. The fact that we're an ISAL, we're also the only cybersecurity agency that has a memorandum of understanding with the FDA related to medical device security and responding to national threats against medical devices. So overall, we've been involved in this for quite some time, and the information I'm going to share with you today really comes to us from partly the experience we've gathered over those years directly working with clients, and also some of the threat intelligence programs that we are involved in and support. So hopefully you'll find us kind of leading edge. The idea here is to give everybody kind of a little bit of background on ransomware. Some of you may be from the technical side of the equation, and you may be very familiar with ransomware. And some of you may understand the term and the concepts at a high level, but I kind of want to give you a little bit deeper dive so that you really understand what's at stake. And then we're going to get into some of the best practices or things to think about when it comes to responding to ransomware. And we're going to attack this from different perspectives. This presentation is not just for the technically minded. This is really, there are going to be things in here we talk about that are specific to the C-suite and board of directors. And ultimately will be the decisions they need to make in order to effectively respond to ransomware. So with that, I kind of want to get into it, and we want to start here. And this is one of those things where I do think that the C-suite and the board really need to, I guess for lack of better terms, pay attention to. This is a news article that came out back in October of 21, and it involves a situation where there was a hospital in Alabama that was hit by ransomware. And it impacted the entire hospital, including medical devices and diagnostic and life support systems. Now, the reason I bring this up is not just solely because of the ransomware attack, but to hopefully illustrate that there's an amazing amount of preparation you have to put in place, and that the landscape has changed in the last 3 or 4 years, where cybersecurity was primarily the focus of the IT organization. And in the world we live in today, I can tell you that cybersecurity has to be led by the C-suite, specifically the CEO. And there needs to be oversight by board of directors. Now, this doesn't really matter how big or small your hospital is. One of the things we talk about that I won't go too deep to in this presentation is that one of the things we really need to think about when it comes to things like ransomware is how do we reduce legal liability and increase our legal defensibility. And the way we do that, the way we increase legal defensibility, is by making sure we make strong decisions prior to an event, prior to a security incident, because typically we're going to be judged 18 months later. So that brings us back to this case that occurred in Alabama, where unfortunately a baby died. And I want to unwind for you a little bit about what happened in this situation. What occurred is the ransomware attack occurred, and there was a woman that came to the hospital who was about to give birth. When she entered the hospital, the ransomware attack had already occurred, and she did deliver the child. And unfortunately, the child was connected, or they couldn't connect the child to a fetal monitoring system. Child had a challenge with their health, which led to the child dying. Nobody detected the issue with the child because they didn't have the right systems to monitor the child. And we're going to talk about some of the things that some of you may say, well, there's no excuse for that. They still should have detected that there was something wrong. And I'm going to explain why maybe the staff didn't do that. I don't know for sure if this happened in this case or not, but we're going to address why, without any systems in place, people can die. Now, going back to this case, the challenge is that the mother was never told that a ransomware attack had occurred. And so she sued the hospital. A civil suit was brought against the hospital for wrongful death. And her case is primarily based on the fact that if she would have been told that there was a ransomware attack, she would have made a different decision in terms of having her child at that hospital. And I think that's a very open and interesting situation. And this is really way beyond IT. And this is why the preamble to this presentation is don't tune out of this if you're not part of the IT organization, because there's much more about ransomware that's not technical, that has nothing to do with the technology of ransomware and defending and detecting it and all those things. We're going to touch a little bit on that. Primarily here, what we're really focused on is, as the C-suite, how would you defend yourself in this situation? Have you put in place full disclosure requirements for any security liability? So let's think about that a little bit. A patient comes into the hospital, and one of the things we have is informed consent, right? If you're going to have some type of treatment, some type of therapy, a surgical procedure, whatever it may be, you're going to sign a document that your care team has notified you that there are inherent risks with pretty much any clinical procedure, and you are willing to accept those risks. The premise of this case is that the patient was never informed of the risk of having a child in the hospital due to a security issue, a cybersecurity issue. So when we think about that and we try to protect our own organizations, now having this perspective, this retrospective, we really need to think about how we truly define informed consent. We live in an age now where informed consent, a patient can have an impact to care, not simply because of the risk of treatment related to the actual clinical procedure, but we could have somebody who's impacted because of a cybersecurity attack. And so what I'm kind of getting at here is you really need to have this conversation at the highest levels of your organization as to whether or not you believe that if you had a security event, or even more so, a step back before that, if you are aware that there are security risks in your organization, if you are aware that there are vulnerabilities in your organization, should those be disclosed to a patient? Should the patient be allowed to make an informed decision that, yes, I want to have my surgery here at your hospital, even though I know that there may be some cybersecurity risks? Now, we've worked with some organizations to help them structure that language properly. I'm giving you a very broad scope of things you need to consider, but my hope is that you're actually walking away from this going, never really thought of that. And the more important thing to think about is those decisions you make, whether you make them or not, will be judged 18 months later. Since this lawsuit has come out, we've seen that there are now law firms that are ramping up to specialize in this area. When you disclose that you have a breach, which is required under HIPAA, they are now looking at those public disclosures and reaching out to your patients and asking if there was any impact to care. So somebody doesn't have to die. It could just be simply that there was an impact to patient care. There was a never event that occurred, a patient safety issue of some sort, and that could lead to either a class action suit or a civil suit. So I want to start here because typically when we're talking, most people think, oh, we're going to start with the tech. And the tech is probably the least of your worries. What's really important is thinking about how you're going to protect yourself, reduce that liability, and increase your legal defensibility as part of a overall holistic security program. And obviously, I'm hoping you're kind of seeing that it's a lot more complicated than just what type of antivirus software do we deploy on a laptop. So that brings us to another piece of this, which is the Vanderbilt study. Now, the Vanderbilt study was done out in 2016-ish. What they did is they looked at significant cybersecurity events across the US at a variety of different hospitals and tried to analyze what was the impact of a significant cybersecurity event on patient outcomes. Now, the way we think about a significant cybersecurity event, what's that mean, significant, is any interruption to hospital operations. So yes, ransomware is obviously an impact to hospital operations. It takes out all of your systems. But more importantly, it could be something other than ransomware. It could be a limited attack. It could be not all your systems are taken out. There are a variety of other types of attacks beyond ransomware that are very, very disruptive to hospital operations. Now, what happens in these situations is once you have a significant event, a significant cybersecurity event, it impacts patient care. And the reason for that impact is simply stated the emotional and psychological response of your caregivers, your very own clinical staff. What occurs, and we've seen this as an organization, we've dealt with incident response since 2013, we see this occur firsthand. We actually don't even need a real security event to see this play out. We've seen this occur when we do tabletop simulations and we simulate an attack. And what we see is that the caregivers, the clinicians, and not just clinicians, pretty much all employees across the hospital start becoming concerned about a few different things. What exactly happened, right? What's going on? Well, I heard there was a ransomware attack. I heard there was a security breach. The next thing is, can I trust the equipment I'm using? Should I use this medical device, this smart pump, or shouldn't I? Should I enter the information in the EMR or not? If I can't get the information in the EMR, what do? Should I write it down on a piece of paper? How do I run orders? How do I get my lab results, right? These things become central to the concerns of the caregiver. We then see this deteriorate into, did they get to my financial data? Do they have my home phone number? Do they have my personal information? Do they have my social security number? Should I shut down my credit cards? So we then see that it goes from operationally centric mindsets to personally centric, right? The caregiver starts worrying about their own vulnerability to the attack. All of these psychological and emotional responses take our focus away from caring for a patient, and that leads to patient safety issues. The problem is that the Vanderbilt study determined that when we have a significant event, they saw that consistently you have an uptick in mortality of patients. So we can see a direct correlation between cybersecurity events and patient outcomes. And if we go back to the previous slide, this is kind of borne out then as a lawsuit against the hospital. So I think it's really important that we start here, that we understand that ransomware is not just annoying. It's not just the hospital being down. It is a very serious situation in terms of the outcome of a patient. And we can make this, this escalates, right? Think about if your family members, if your loved ones were in a hospital hit by a significant cybersecurity event such as ransomware, how comfortable would you feel having them in there? Would you want them transferred? Would you be trusting of your staff to stay focused on patient care? And we all say yes, I'm sure they would, especially in smaller hospitals. But the reality of this is one of the very best things you can do to respond to a ransomware event is train before the event, make decisions before the event regarding informed consent, and realize that without training, without simulation, without putting people into situations, they will not be prepared to respond to an actual event. So something to think about, hopefully kind of, again, this foundational kind of start where first steps we're taking into this presentation are not just eye-opening, but start giving you food for thought, and more importantly, some action items that even if you listen to nothing else in this presentation and your focus is just on what are we going to do to keep our staff focused on patient care with any significant cybersecurity event. Secondly, what are we going to do about informed patient consent when it comes to cybersecurity? And lastly, how are we going to practice this so we make sure we're good at it? If you just did those three things, you'd be way, way ahead of the rest of the world. One thing I will bring up that I don't think I have in the slides here is going to paper. So a lot of times I'll hear people say, well, if we have this, ransomware event or a significant cybersecurity event, we'll just go to paper. We practice that every 6 months or whatever. Here's something I want you to keep in mind. The average outage from a significant cybersecurity event, especially ransomware, is between 6 to 8 weeks. So most people, when they assume they're going to be out, they're going to be going to paper, the systems are down, they're usually thinking 24 to 48, maybe 72 hours. So it's very important that if your strategy is, this is no big deal, we'll just go to paper, that you've thought about everything related to how do you maintain paper for 6 to 8 weeks, because that's the average time that you're going to be dealing with the ransomware attack. That doesn't even include recovery operations. That's just trying to figure out how to get through this and get some semblance of normalcy back. So think about that as you, again, think about your strategy. So I want to talk a little bit about what exactly are we talking about with ransomware. And this, I think, is important to make sure everybody's on the same page, right? Because we kind of sort of use ransomware, we hear about it, we know it's one of the largest security threats related to healthcare. But ultimately, ransomware can affect anything. It's not just about your computers. It can impact your mobile phones. It can impact your tablets. It can impact every one of your medical devices. It can impact your closed circuit TV systems, your physical access control systems, your oxygen distribution systems, every television, smart TV that you may have in the hospital. The important part to take away from this is that ransomware can and does impact anything with a computer chip. I can release ransomware in your home across your home network, and it would take out any device that's connected to your home, depending on how I craft my ransomware attack. And the reason I bring that up is we often don't realize the level of impact, right? And when we go back to the psychological impact on our teams, think about the fact that, if we have the right ransomware released, every one of your physical access control systems, if you're using key swipes or access cards, is gone. So those doors now can't open them, they're locked. Think about that, what the impact is to labor and delivery in that situation. Think about food systems, all your nutritional systems, dietary systems are now taken out. So it's a very deep impact. It's something that until you go through it, you don't really understand. And again, this is where simulation is so important, because we can simulate these things and put people in positions where things they may assume to be okay. We had a situation where we did a simulation with a hospital, just to give you an example, and we launched ransomware with simulation. We didn't do it on their network. We kind of, sat around a table and went through a typical ransomware attack scenario. And one of the things that we did in that simulation was take out all of their smart pumps. And they learned very quickly that nurses have lost the skill to quickly figure out titration settings or titration calculations. And so that became an impact, because now you have nurses becoming concerned about their calculations and trying to buddy up with somebody. And the hospital realized that part of their downtime really needs to be much more broad in terms of how they plan, because in the past, when they did downtime procedures, they only really talked about the desktops going down or the servers going down. They never really said, well, every smart pump in the hospital is now down. And that's kind of what you're facing with a ransomware attack, right? Everything can be down. So just want to make sure we have a really clear view of what we're talking about. So I often get questioned, why? Why do people do this? And ultimately, the reality is return on investment. The average ransomware attack yields about 1,400% return on investment for the attackers. It is very inexpensive to launch a ransomware attack. And if you do them, you're getting an amazing profit margin. And so this has now become a very well-established business. And I want to make sure you understand who your adversary is. These are not kids in a basement. It's not some antisocial person who's college dropout and has decided to become a hacker. These are not hackers. I want you to clearly understand that ransomware organizations have 24/7 call centers. They have HR departments. They have people that work for them get salaries equivalent to Google or Microsoft or Apple. They have full benefit programs. They have bonus programs and incentive programs. They do recruiting actively on college campuses in Western Europe. They usually hire people who have a master's or PhD in either computer science or electrical engineering. So I want to make sure that you as a leader, whether you're an IT leader or you're an executive or board member listening to this presentation, never make the mistake to believe that these are just some silly kids or some people that are antisocial, and maybe somewhat antisocial. They have a very serious set of skills. And more importantly, they have the financial resources that if they want to target you, it's going to be a bad day for you if you don't really understand your adversary. Now, one thing I will get sometimes is, especially smaller hospitals, we're small. We're a critical access rural hospital. Who's going to want to come after us? You guys are extremely great targets. And the reason is for that exact belief that I just shared. Well, who would come after us? The reality is you have many of the same systems in your hospital. You're using many of the same medical devices, security systems, software, hardware that's being used at either larger institutions or other organizations in other industries. So you become an extremely important test case, right? Because if we can penetrate you and get to your systems, we learn a lot. And then we can take those learnings and go after bigger organizations. So I just want to make sure that you very clearly understand that if you're walking around thinking, what's the big deal? We're small. We're in the middle of a rural area. Nobody knows we're out here. You're really doing the ostrich thing, right? Just to be honest, you got your head in the sand and you're kind of hoping that you can't see anybody, so they're not going to see you. That's not how this works. These organizations are very targeted. The other thing is if you have any kind of industrial complex near you, even though you're smaller, for example, larger companies, intelligence or Department of Defense or defense contractors, if you're in regions that service any of that, or you have employees of those organizations, you are also very much a very worthwhile target for this type of stuff. So that's kind of the background. So the ransomware attacks have been advancing. In the past, it was all about, hey, somebody clicks on a link or opens a document or opens an email and boom, the machine is impacted by ransomware and then it spreads. That still goes on. But thankfully, in some ways, that's gotten harder to do. But attackers have been evolving their capabilities. The reality of life is that attackers continue to innovate. I often, when I lecture directly to IT security people, one of the things I make sure I get across to them is that most security practices are 10 years behind the capability of attackers. And that's not the fault of IT or IT security. It's the fault of senior leadership not understanding the complexity of this threat and supporting the IT and IT security department in a way that allows them to close the gap between where they are and where the innovation of the attackers are. But that's a whole different presentation. But I want to make sure that you clearly understand that attackers continue to innovate. Now, some of the things that we've seen as defenders have gotten a little bit better at defending this is alternative tactics. So what we see happen today is the attackers get in your network. We don't really see the open the email, boom, the attack takes place. What we see is the attacker gets into your organization, and on average, they're inside your environment, inside your network for 197 days. That's the average, and that average doesn't change much. It hasn't changed in about the last 5 years, just to put it in perspective. So once the attackers are in, they start to catalog all of your systems. What medical devices do you use? What are your servers? What are your desktops? What are your laptops? What software are you using? Everything and anything they can figure out. What phones are connected? Are you using VoIP, voice over IP phones? What are you doing? How many facilities do you have? They're going to launch a very strong intelligence gathering campaign. Part of that is going to be seeing if they can get the data. And they're going to start figuring out, can they embarrass somebody? Can they compromise integrity or confidentiality? Can they introduce fear? And I'm going to explain that to you in a little bit more, but ultimately, can they leverage your patients, your partners, your clients, your staff to further their cause of getting you to pay for ransomware? So the point is they're actually data mining, right? That's one of the big things that they're doing. The other thing that they're adding to this is time and stressors. So in the past, when a ransomware attack occurred, it would just happen. Now, when it occurs, there's a timer that appears on the screen. I think I have a slide in here that'll show you an example of that in just a little bit. But ultimately, it says, hey, you've got 24 hours to pay, or we're going to double the ransom. Or they'll say something like, you've got 8 hours to pay, or we're going to start deleting data. So those types of things, or they'll say things like, you've got 8 hours to pay, or we're going to destroy your computer systems. By destroy, we mean truly destroy, what we call bricking, right? Where basically the system's now a brick. You can't replace it. You can't recover from it. You can't reset it. You can't set it back to factory defaults. You literally take the machine, put it in a dumpster, and order a new one, which is a very serious complexity if I do that to all your medical devices, right? Imagine if you have a cath lab or an MRI or CT and I brick that device for you. You now need to basically get a new CT machine. Or replace your entire cath lab infrastructure. So these are some of the things that they're adding in, right? They're basically going, oh, okay, you guys are going to hold off on paying. We're going to make it a much more serious situation for you. Now, understand here that these are just tactics that they've employed. They haven't really had to evolve their technology, right? So they're really thinking about how to manipulate you from a psychological perspective. The second thing we see is exploitation. And what happens here is they've gone through your data. So they know who your VIPs are. They know why people have been in the hospital. And this becomes a very serious situation. They mine the data. Now, what we've also seen is that they befriend people on social media. They'll figure out who your employees are. They'll get to know them on Facebook months before the attack takes place. They'll get to know them on Snapchat or on TikTok or on Instagram. They get to know people. The people that are being targeted don't know that these are attackers. They just put up fake profiles and get to know them. And they may say, oh, yeah, I'm a nurse in such and such a location. I'm a doctor at this hospital. And people just get to talking. The reason this is done is to, again, further up the chances that you're going to pay whatever they ask. And the way this happens is typically what we see is you say, I'm not paying, or I'm not paying in the amount of time, or I'm not paying that amount of money. And they come back to you and say, well, that's fine. You'll be hearing from us shortly. And what they do is they reach out to your patients. And they have all your patient data. They've been in your system for 197 days. So, which is, over 6 months at this point, right? So at that point, they just reach out directly to your patients. And by directly, I mean actually call your patients at home or on their cell phone or email them. Whatever they've gotten in terms of patient data, they will call them. And when they call, they typically target patients who have something that typically they don't want somebody else to know. So you may have had patients that are in your hospital for some type of rehab or addiction or behavioral issue, or they may have had something like an STD or something of that nature. And what they'll do is they'll reach out to those patients and tell them, we know that you had this situation. We know you were in this hospital from this period of time. You need to call the hospital and tell them to pay this ransom, or we're going to expose this information. We're going to make it public. Now, some patients may be like, whatever, I'm not giving into this. Some of your patients, including people like board directors and families of board director members and prominent people in your communities, and in a smaller community, this is even more effective, may be very concerned about certain information getting out from their health records. The point is, you now are going to have patients who are panicked, calling, trying to figure out what is going on. And I'm going to give you a tip here. This is one of the reasons when you have any kind of significant security event, do not keep it private. Your best thing is to disclose as quickly as you can. Forget OCR, forget HIPAA disclosure, forget all that. You want to be out in front of this and explaining you're doing the best you can, that there's been a security event and you have whoever involved helping you. It's really, really important, but the exploitation works really well. So that's patience. But we talked about the Vanderbilt study. So if I'm an attacker, right, as a consultant, I'm telling you, you got to train your staff to stay focused on patient care during a significant event. As an attacker, I would tell you what I'm going to do is call your staff. Why did I befriend them on social media months ago? Because I'm getting to know them. I'm getting to know where their kids go to school. I'm getting to know if they have kids. So I'm very likely to send them an email saying, hey, if you want to see your kid again, and they go to such and such a school, you probably want to tell your employer to pay this ransom, or you're not going to see your children again. Now, do they actually kidnap the kids? No, we haven't seen that ever happen. In fact, they're probably somewhere across the world in some Eastern European country. So the chances of the child being kidnapped are not probably very, very low. But here's what happens. Your staff is freaked out. Word gets around that somebody got a call, that the attackers called them directly. If you don't think that your staff is going to be up in arms about that and not focused on patient care, you have a very different perspective of what we've seen actually happen. So you need to understand that this game is a very complicated game. And again, none of this is IT related, right? Having the safeguards in place to understand how do you keep your staff focused on patient care? How do you deal with staff or patients calling you and saying, I just got a call from an attacker? How do you manage and navigate that can get rather complicated. So these are kind of the things that we're seeing happen now when people are faced with these types of attacks. Multi-stage attacks are simply where the attacker gets in, unleashes one attack and then another attack and overwhelms your resources, and then eventually goes to a ransomware attack. That's all that is. We've talked about psychological attacks, which is, hey, if you ever want to see your daughter again, you'll get your employer to pay the ransom, right? That's a psychological attack. And that talks directly to what I mentioned with the Vanderbilt study related to how do you take your staff off of their game, right? So let's talk about attack violence and velocity, right? That's something we don't really talk about in the cybersecurity world. Attack violence is simply what is the outcome of this attack? Has somebody's safety or personal care been impacted? And we've talked a bunch about that. Velocity is how quickly this attack moves, right? How quickly does the actual attack itself take place? Not all the aftermath of it, but the actual, from the moment the attacker says go to the moment they own all of your systems. How does that actually happen? How long does that take? So I'm going to skip this slide, but I want to talk a little bit about trauma medicine, if you will, for a moment. This is something I'm really passionate about. Ultimately, I wanted to be a trauma surgeon. I got the chance to go down to the Shock Trauma Center in Maryland, actually, the Dr. Khalif Shock Trauma Center. It's an awesome place. And one of the things we learned there, obviously, that came out of that trauma center was the golden hour, right? That if we can get you definitive trauma care within a period of an hour from the time your trauma incident takes place, your chances of survival are much higher. So we took a lot of this, and this is, we can't go into this in our program, but we've taken a lot of the incident response practices that we preach and teach people come from actually the Shock Trauma Center in Maryland. We've just applied them to IT. But one of the things we learned is this concept of the golden hour. And what that is basically something we call the critical success target or critical success window. And this is from the moment that your organization realizes an attack has been launched, how long do you have to contain that attack or prevent further damage from occurring? And so the answer is about 14 minutes. So when you're thinking about this from an executive perspective or IT perspective, all of your incident response plans, your ability to detect that you have a significant attack, such as ransomware, occurring in your environment, everything has to be designed to try and contain that attack and stop it in its tracks within 14 minutes. And that doesn't matter if it's Monday at 2 o'clock in the afternoon or Sunday at 3 a.m. And for critical access rural hospitals, this is a really tough challenge because you may not have the resources in place at 3 a.m. on a Sunday to deal with shutting down this type of an attack. And so it's really important to think about this. And there's a bunch of different things you can do to address this, which go beyond the scope of this presentation, but happy to talk more about them if you wish to reach out directly. But I want to get in your head that you have to get your organization to a point where you can detect and respond to an attack within 14 minutes. Whatever tools you're going to want to use, those are kind of the conversations you have to have as a team between your senior leadership, your board, your IT team, is if we had an attack here, could we really detect and respond within a 14-minute window? And for many of you, the answer will be no. And some of you you're going to hear, even if we had the best tools and everything in the world, we still couldn't do that. And so what you do is you say, okay, can we do it within 30 minutes? Can we do it within 45? And let's say somebody says, yeah, we could probably do it within 45 minutes. We could detect and respond within 45 minutes. Okay, fine. So that's our starting point. What do we got to do to get to 35 minutes, to 25 minutes? You may never get to 14, but from a defensibility perspective, it's important to know that you've examined this, that you had these conversations, that you tried to do the best you could to meet this standard. So let's talk a little bit about how ransomware moves and what it does, right? So we often tell people, hey, don't click on this, don't click on that. But actually seeing ransomware in action, I think, is important to see. So I'm going to skip some of this stuff here. Go and really go to, well, actually, let me talk about some of this a little bit. One thing to train your users on is if they click on something and they don't see anything on this screen, the idea here is you've clicked on this document, it's an invoice, your finance department gets it. Maybe somebody's like, I don't know why you sent this to me. I'm disputing this invoice, something like that. They open it and they don't see anything. It's a blank screen. So they may forget about it. Maybe like, no, oh, I don't know what this is. I got other things to do. I'm going to shut this down. The reason this is important is most times when we train our end users, we're training them to, we say things like, if you see something weird, if something, if your computer does something weird, let us know. Well, this isn't weird. It's just a blank piece of paper. It's like telling a small child, if you see a stranger, yell or run or whatever. Well, most kids, a stranger is, something that looks like a stranger or a bad person in a cartoon. And if it's somebody friendly with a nice smile, they're not a stranger. Same principle applies here. I've opened a document. It's just a blank document. There's nothing weird on my screen. But yet we have a ransomware attack in this situation that would be occurring behind the scenes. And typically what's going to happen is this user is going to see some kind of message on their screen, but we don't really explain to the user what is the message or what should you do. So this concept of, if you're going to train end users, you really need to give them concrete examples of what they're going to see. And that's why I include this here in this presentation. And we're happy to share these slides with you. If you wish to use them for your own presentations, just reach out. And then ultimately you can see here these on the screen, you see that the files have all been scrambled, those numbers. Now, if I open one of those files, if I double click on any of them, it's going to look like this. So even if I open like a Word document or an Excel spreadsheet, it's going to look like this. This is what the encryption is going to look like. So there's nothing you can do with that. And if you have the right key, you can decrypt, but pretty much at this point, you're done. And typically this will spread across your network and just lock up all the files that it finds. Sometimes we'll hear things like, oh, well, we have antivirus. We see a lot of situations now. Remember, the attackers are in your network for 197 days. So the other thing they're doing besides getting to your data and cataloging your systems is creating the right environment for them to be successful. So if you could see here, you have a green check mark for virus and threat protection on the lower left. What they do is they run scripts to turn that off. And unfortunately, you don't know it's been turned off. And then within seconds of this being turned off, they run the ransomware attack. So they basically turn off your security tools. So again, a conversation to be having is, how would we know this happened? How would we know that our antivirus or whatever tools we're using would protect us from this? Or would alert us that our systems have been turned off, our security systems. So what I want to do is I'm going to show you actually a little ransomware attack, and then we're going to kind of get into a few more business things around should you pay, not pay, ransomware strategies and things like that. But I want to show you how quickly ransomware spreads. So you're going to see a little video. There might be some music with it or not, but if there's not, you can read little pop-ups on the screen. It takes about 2 minutes or so. And you're going to see the screen's going to be divided into two sides. A computer on the left is where the ransomware attack begins, and then it spreads to the computer screen on the right. But we'll just get into it and kind of give you a chance to watch this occur. So the important thing here to take away is obviously the speed. And there's a couple things I want to point out to you that may not be readily apparent as you watch this. The first thing is that as the second computer was impacted and affected without the user on the second computer doing anything. We're assuming on the first computer on the left, something the user did, but it doesn't have to be a user. The attacker could have just got to that computer, infected it, and then started spreading. The spreading comes, it basically evolves, right? Because it compounds, right? Because what happens is now that second computer will start going out and finding another computer to go after. And then that third computer will join the first two. And now you have 3 computers going across your network, and they each impact one. So now you're at 6 computers, and then those 6 go out and you're at 12 computers. So this moves very quickly. This is why that 14-minute window is so important to try to get to, because within minutes, you will have your entire environment shut down. So just wanted to kind of show this. I've talked to a lot of IT people, IT security people, and they've never even seen a ransomware attack yet. We talk about it. So I thought maybe watching one actually occur was a good way to kind of help you really rationalize all the things we're talking about. So with that, let's talk about HIPAA and ransomware. There's a lot out there about, who's covered, who's not covered, what do you have to disclose, not disclose. I'm not an attorney, so what I'm going to give you advice to do is have a conversation with your attorneys or outside counsel in terms of, what do you think is the proper response to disclosing that you've had a ransomware attack. Now, earlier I told you, regardless of what HIPAA says or what your attorneys believe HIPAA says regarding ransomware, my suggestion to your C-suite, your board, if you ask me to come in and talk to you, is disclose the attack. You don't want a situation where a patient comes into a hospital, nobody told the patient, now if something happens to that patient, or in the case what we talked about earlier, their child, and now you're facing a civil suit, not because you didn't disclose the HIPAA, not because you had a disclosable breach, but because you did not disclose to the patient that there was a security issue that potentially could impact their well-being and care. So my suggestion is, yes, you can go round and round and round. Should we disclose this to HIPAA, OCR? Is this a reportable event or not? Or you can kind of just do what's right and think about how you would want to be treated, what you would want to know if you were brought into a hospital that was undergoing some type of security attack, especially given all the things I mentioned about the Vanderbilt study and things like that. So do you pay or not pay? I hear a lot from different sides. I will tell you there's a few things you need to be familiar with and aware of. One of them is that there has been guidance put out regarding payment of ransomware to entities that are considered enemies of the state. In the simplest terms possible. Basically, the United States keeps a list of countries and entities within those countries that we consider to be adversarial. If you pay ransom, and these countries and these entities do attack and use ransomware way to fund their operations, right? It's one of the big things they can do is go hit hospitals, get paid, and then they use that money to fund whatever else they're doing. The problem is that if you pay ransomware, and you pay it to one of these organizations that are considered adversarial to the United States, you are personally, whoever you are personally in violation of national security policies. And at that point, you could be brought up on federal charges. The reason I'm bringing this up is because this does not fall under like things like D&O or malpractice or professional fiduciary stuff. You need to understand that the government would come after you. There's no protection from your organization if you did something like this. There are some things you can help to minimize your impact in that situation. And one of them is to get law enforcement involved. A brief word on law enforcement. It's always important to call them and notify them, but they cannot respond. If you call the FBI, they're not going to show up at your hospital with a bunch of Tahoes and people wearing blue jackets with gold lettering and running in to save the day. If you call FBI, chances are they won't even get back to you for 72 hours. And once they get back to you, there's a very high probability they won't even come out to your hospital. They'll just ask you what happened and what'd you do. And that's about it. We don't see them come out and do all kinds of forensic stuff. They just don't have the manpower to do that. So just keep in mind that you should at least notify law enforcement, even local law enforcement, and let them make or push them to make a decision as to whether you should pay or not, or at least gather intelligence that if you do pay, are you going to be in violation of some form of national security policy? The other thing you need to know here is cyber liability insurance. You need to look at your cyber liability insurance and determine if there's anything in your cyber liability insurance that prevents you from disclosing to patients or staff that you've had a security incident. We have had way too many incidents in the past 12 months where there's language in the security policy, cybersecurity liability policy, that does not allow you to disclose things without the consent of the insurer. And this is a very serious situation because that lack of consent could lead to other problems, as we've discussed. So make sure you go through your cyber liability insurance and determine if you're restricted from disclosure. Third part, getting back to this payment thing, make sure you talk to your cyber liability insurer as to will they pay if it's determined that the people that are attacking you are on some form of national security watch list. Or are they going to say, sorry, we can only pay if it's, you know, a non-adversarial attacker, which is kind of an oxymoron because they've attacked you. So they're adversarial, but they may not be adversarial to the United States. So there's a few things here you need to think about in terms of will you pay or not pay. Some of the things that you may want to consider before you make this decision is conduct a ransomware simulation. Figure out what your exposure is going to be. Figure out how long you can go. Truly, how long can your hospital operate with no computers, no medical devices, no nothing? How long would you do? How long would you be okay? And then determine, you know, what's your tipping point. One thing we will tell you is ransomware has gotten very expensive. So you can see here on the screen, it says you must send us 1 Bitcoin for each affected IP to receive the private key. So if you have 500 computers in your environment and you have to pay 1 Bitcoin for 500 computers, at the time that I did this, put this presentation together, and by the way, this is an actual communication with a attacker, this would have been $4.9 million. So even if you're a very small institution, 500 Bitcoin could really devastate you. So again, you also have to think about what are your cyber liability limits and coverages, because it doesn't take a lot. So one thing I would recommend is negotiating with the attackers. If you've made the decision to pay, or even if you're not going to pay, negotiating makes a lot of sense. Tell them you're a small hospital. Tell them you're the only care for X amount of miles. People rely on you. You have people in there trying to have babies, people that are having heart attacks. You need to reach out to them. Every ransomware attack we've seen either has a way to chat with the attackers, email the attackers, or call an 800 number that has a call center that can take your call 24/7. So think about how you will negotiate and who will negotiate prior to the attack. This should be part of your planning. Document that communication and see if the attackers take pity on you. We know of cases where attackers said, oh, yeah, you actually weren't the intended victim. There's a very famous case in Germany where the attackers went after a hospital in Germany. A hospital went on divert. A woman was en route to the hospital, was diverted to another hospital 30 miles away. She died in transit. The German police department, the German federal police considered that a homicide. They went and started negotiating with the attackers. During that negotiation, the law enforcement mentioned the name of the hospital. The attacker said, wait a minute, what's the name of the hospital? And they said, oh, it's so-and-so hospital. And the attackers actually said, oh, we're very sorry. That's not the hospital we were intending to attack. Here's the decryption key. Sorry, we apologize. Unfortunately, somebody died in that situation. My point of it is negotiate. Try to figure out a way that maybe they will take pity on you. And if nothing else, maybe they reduce the amount of the ransomware. Maybe you can get a package rate. And I know it sounds funny. I'm not trying to make light of it, but you can negotiate. And again, this goes back to the return on investment with these attackers, is they have full-blown customer service departments, right? They're funding, which is why they have call centers and chat and all of these other things. So something to keep in mind. So what can you do to defend yourself? There's a bunch of things you need to think about. You need to have segregation on your networks. This is, something you have to think about putting in place? How do you segregate the important things on your network and be able to shut them down very quickly? Invest or overinvest in user training and education. They are your first line of defense. Your most important people in a ransomware attack are going to be your help desk. And I can get into that more, but in the interest of time, you trust me on this or reach out and I'm happy to explain why the help desk is so important. But it is the most important people you have will be whoever is manning that help desk in your organization to contain and prevent that ransomware attack. Patch your systems. You have to patch. If you don't, there's going to be an invitation to attackers. You need to think about how you're going to do incident response and then test it. Do you really have the ability to respond to a very serious situation? And if so, where are the tipping points? Where do things break down? And you need to have somebody monitoring. If you're a smaller institution and it's 3 o'clock on a Sunday morning or even 2 o'clock on a Monday and your team hasn't been through these kind of things, you need to get the right resources that you can get in place very quickly or are monitoring your environment. So you need a security operations center at some level. And I know it's expensive to do all of this, but there are strategies and ways you can do much of this. So you need to think about what you can do and maybe do it over 18, 24, 36 months, but get yourself on a path to get there, especially because it improves your defensibility, your legal defensibility to demonstrate that you are putting in place the right practices and not just throwing your hands up. A few things, you can think about. We've talked about check your liability, cyber liability insurance, who pays what are your limits, what are your disclosure rights, board briefings. Happy to do this exact briefing for your board. We don't charge to do that. We don't charge to do this type of briefing for your end users. We're happy to do these for end users. You can reach out. We try to be respectful of rural hospital systems and critical access. So, we can do tabletop simulations rather inexpensively, and we can do pen testing. If you haven't done an internal pen test, whether you use us or not, please go get an internal pen test done so you know where an attacker could get to and what type of damage they could do. It is a very eye-opening experience if you haven't done one. And if you do them, make sure that you rotate your vendors so that you get different perspectives. Talked about all the services we do. I don't want to bore you through that. And also the fact that we have a solution specifically for critical access rural hospitals that includes a tremendous amount of end-to-end security solutions that are all part of one package. And we've tried to price very aggressively for this market segment. So with that, I hope you got one or two tidbits out of this. I'm not trying to scare anyone. I just believe in being very honest. This is now more than just an IT situation. This is now a daily operational consideration for how do you run the hospital in light of this current threat landscape. So with that, I'm not sure if we do have any questions or not. I'm happy to take questions, but otherwise, I truly appreciate the time you guys have given me today. And again, I hope truly that you get something out of this.
Thank you, John, for your presentation today. I know that I personally learned a lot. I will, if there's any questions, feel free to raise your hand on the Zoom feature. But regardless, being proactive is definitely a necessary step for rural hospitals and healthcare organizations to take, especially with all of the dangers out there today. So again, thank you, John, for giving us this great presentation. If you're catching this live, fantastic. If not, this will be embedded into our next upcoming newsletter and on our YouTube channel so that healthcare IT professionals definitely can review this, and C-suite professionals also can view it as well to take advantage of this great education that John provided us today. Again, John, thank you so much.
Sounds good. Thank you so much.